Here's a scary statistic. 1 in 5. 1 in 5 Americans are affected by a mental health disease. And only half of those affected are receiving the treatment that they need. That leaves 30 million more Americans who go about their daily lives affected by a mental health disease and are not receiving treatment. I offer no other expertise on the subject other than being a concerned citizen. Our mental health system is broken, and there is need for reform. In response to the tragic events that have shocked our nation recently, political parties have used this opportunity to also voice another hot topic, and that is gun control. But is further gun control needed? Well, here's another statistic for you. You are 600 times more likely to be killed by medical malpractice than you are to be shot. You are 40 more times likely to be killed by a drunk driver than to be killed by semi-automatic fire. Even scarier, right? So I ask, is further gun control needed? Or is mental health reform needed and should be the main focus of our political leaders? And in light of the recent tragedies, certain political head figures have voiced their concern on mental health reform. If you look at slide 4 of the PowerPoint presentation, you'll see that Speaker of the House Paul Ryan has voiced his concern, stating that mental health reform is a critical ingredient in stopping future shootings. And on slide 5, you'll notice that President Trump has also stated that his administration is committed to working with local and state governments on stopping future shootings by reforming mental health. As it stands now, anybody who is involuntarily committed to a mental health facility or was adjudicated by a court to seek mental health treatment cannot buy a firearm. Well, this was not the case with the Parkland shooter, Nikolas Cruz. The FBI had been called in numerous times and had documented Mr. Cruz's mental status. But because Nikolas Cruz was neither adjudicated by a court nor involuntarily committed to a mental health facility, he could still legally buy firearms. And what about Stephen Paddock, the Las Vegas shooter? Now, his own doctor has gone on to state that he thought Mr. Paddock was bipolar and even offered antidepressant drugs, to which Mr. Paddock refused. Mr. Paddock was on anti-anxiety drugs, but there was a clear documentation that there was need for mental health intervention. In both cases, there was documented proof that there was some need for mental health intervention. But sadly, because of the way our federal government has shifted the financial burden to local governments, treatment was not given. Now, don't get me wrong. Not all that suffer from mental health disease are violent. In fact, only 4% of the violence that happens within our nation are committed by those who have a mental health disease. That's 1 in 25 scenarios. But clearly, there is a need to fix our broken mental health system. Combine that with moderate gun control, gang aversion strategies, and we would cut down on the amount of senseless violence that befalls our nation dramatically. On slide 3, you'll notice that there was a bill proposed in 2017, the Better Care Reconciliation Act. This act would allow insurance companies to essentially stop or reduce the amount of treatment that a person gets for mental health. Now that means all mental health, substance abuse, any of the various mental health diseases. There was a article published by on how the Senate Health Reform Act is taking us backwards. Now, we already had a system that worked. When people displayed that they had a mental health disease or problem, we helped them. We treated them. We admitted them. But now, we just medicate them. Send them back out. With the Better Care Reconciliation Act bill and the $370 million that this would save the federal government, $370 billion that this would save the government, that would cut coverage to 22 million more souls. Now we're up to the full 20%. The 1 in 5 people in this nation that are affected by a mental health disease. Now we're just doing away with all of them. Not just half, all of them. And now the financial burden would be placed onto the state. Luckily, there has been a roadmap to mental health reform pillar plan that has proposed that should help states meet the financial burden and ensure that they can get through paying for all this. On the website Thresholds, there's an article called Roadmap to Mental Health Reform. It's a 6-pillar system that details what each state must do to ensure that mental health services are sought, that treatment is given, and that the state can financially support it. Pillar 1 is early diagnosis. Catch it before adolescents who don't have any sort of coping mechanism go critical. Step 2 is structure budgeting that allows for more mental health facilities, that allows for more mental health treatment. Pillar 3 is to allow for children, adolescents, and young adults to receive treatment. And Pillar 4 is a good one. Absorb the cost. The state must absorb cost of proven mental health treatments that work, but insurance companies will not cover. Number 5, or Pillar 5, is to boost the job market. As it stands, there is a major call for mental health workers across the board. This is due to bills like the Better Care Reconciliation Act that have made it unenticing to become a mental health counselor. So by boosting the job market and giving incentives and whatnot, hopefully you can bring in more mental health workers across the board. Therapists, counselors. And Pillar 6 is to offer low-cost housing options to people who have mental health problems. Now, this would help ensure that they're somewhat isolated, but not to the point where they're out of society. And it stops the never-ending cycle of, homelessness, crime, and then a court getting involved. There's no doubt that our mental health system is flawed. The federal government has backpedaled and has tried to use other terms like gun control to scare the public away from the real issue. Workers in treatment facilities are seeking new careers because there's no job security anymore. Correctional facilities are now treating individuals with mental health disease instead of correcting criminal offenders. In fact, in 2014, a study was done that showed that there was 10 times more people in correctional facilities than there were in actual mental health facilities. Now, it's 10 times more people that should be in a mental health facility, but instead are in the state's de facto mental health facilities, which are correctional facilities. Now, these places are not set up to treat people such as this. I mean, sure, they have psychologists, they have treatment options, but they're just not set up for this. And this is what the APA voiced their concerns over in a 2017 article. Our mental health system is broken. Is there any real way to fix it? Well, it seems with the way our federal government is shifting the financial burden onto the states, that states won't be able to meet the demands, and it's up to us as citizens to correct this. The government we have entrusted to do this apparently doesn't want to do it. All they're concerned with is saving money where they can, which is understandable, but 20% of our nation are affected with a mental health disease, substance abuse, schizophrenia, you name it. 20%, that's 1 in 5 people that you know. You may not know that they have a mental health disease because many of them go about their daily lives seeming normal. But for a majority of them, they're not receiving treatment. And this could lead to future problems. So, I appeal to you to contact your state senate, your state congressman, whoever. The need for mental health reform is now. Thank you.